Good morning and welcome to Health and Social Services for February 6th. And can we do the roll call, please? And thank you. Is there any declarations of pecuniary interest in any items today? Hearing none. Because this is our first meeting for 2025, and we now need to turn to election of a vice chair, and I'm going to turn to committee members for nominations. Okay, Councillor Anderson.
Dies. Oh, it's just on. Councillor Dies as vice chair.
Okay, and second by Chair Henry. Will you take the nomination, Councillor Dies? Thank you. That was an answer of yes, she will. Is there any further nominations? And again, any further nominations? Motion to close by Chair Henry, seconded by Councillor Anderson. Well, and all in favor? Any opposed? And Councillor Dies, for the next 2 years, you will be the vice chair for Health and Social Services. Welcome again. Need a motion for the adoption of the minutes for December 5th. Chair Henry, second by Councillor Anderson. Questions? Any opposed to approval? Seeing none, no statutory public meetings. Our first presentation is, our only presentation, is with Alex Swirsky and with Tara Supanzik. Tara's online and Alex is present. And climate change in health in Durham Region, assessing the impacts of solar ultraviolet radiation. Tara, I guess Alex is having technical difficulties.
Through you, Madam Chair. Thank you and good morning, everyone. As you may remember, I am the Climate Change and Health Specialist in the Durham Region Health Department, and I'm here again to share the next report in our series on climate change and health. Today, we are happy to share our second vulnerability assessment in the series, which focuses on solar ultraviolet or UV radiation. Next slide, please. So this morning, after a very quick review of the purpose and mandate of the Climate and Health Report series, we will share key highlights of the Solar UV report. So that's an overview of our assessment framework, our main findings, local strengths, as well as needs and next steps. Next slide, please. We wanted to quickly review once again why we're completing the report series on climate and health. As we've mentioned before, Durham Region Health Department is mandated to conduct health vulnerability assessments under the Ontario Public Health Standards. Secondly, we know that health impacts from climate change are not just a future concern, but are happening already. And we know that a healthcare system will be burdened by a wide range of climate-driven emergencies. And we also know that some people face greater risks from climate hazards than others and need to be prioritized both now and in the future. And lastly, as we've mentioned in past presentations, a public health survey has found that Durham Region residents do not believe they will be harmed by climate change in their lifetime. So this highlights a real need to both assess as well as really communicate health risks of climate change in order to increase the capacity of community members to protect themselves, their homes, and their communities. Next slide, please. So here again are the 7 planned reports. As you may remember, the report series encompasses a very large background primer, which we released last summer. And the primer provides key background information and outlines the 6 main climate hazards expected to impact the region and residents due to climate change. And I'm happy to share that this month we just found out that the primer is featured on the United Nations Disaster Risk Reduction website under its disaster prevention webpage representing Canada. So we're very proud of that. The primer is then followed by 6 reports organized by the 6 climate hazards, as you may be aware. As you recall, the extreme heat report was released last fall. And then in addition to the solar UVR report, which is released today, there's 4 remaining reports scheduled for this year. So those will focus on vector-borne disease, air quality, extreme weather, and food and water impacts. Next slide, please. So what are the objectives of this solar UV radiation report? There are 4. So the first is to improve understanding of how solar UV radiation impacts health. The second is to assess and report on available data and evidence to understand local health impacts, both now and in the future. The third is to prioritize health equity by identifying and prioritizing people and communities most at risk. And then the last objective is to establish a baseline for future analysis. Next slide, please. So you may recall from our extreme heat report how we assess climate vulnerability. So similar to extreme heat, solar UVR vulnerability is assessed through these 3 factors: exposure, sensitivity, and adaptive capacity. So for example, people who work outdoors, such as agricultural workers, would have increased exposure vulnerability. Children also experience exposure vulnerability because approximately 80% of a person's lifetime exposure of solar UVR is received before the age of 18. Sensitivity is vulnerability due to factors such as age or health status. So for example, infants, children, and people taking certain medications have skin that's more sensitive to sunburns and have a higher risk of skin damage from the sun compared to the general population. So for example, a single severe sunburn in childhood can double a person's risk of melanoma, which, as I'm sure you know, is a very serious form of skin cancer later in life. And then there's the final vulnerability factor, which is adaptive capacity. So this is a person's knowledge and ability to protect themselves. So a person who has difficulty affording protections like sunglasses or sunscreen, or who lives or works or plays in settings with little or no shade, would have limited adaptive capacity, which also increases their vulnerability. So as we've shared before, we really want to focus on the priority populations on the left-hand side that fall into the high risk category. So they experience all 3 vulnerability factors. Next slide, please. So what do we know about solar UVR exposure in Durham Region? No surprise, solar UVR levels in Durham Region are highest from April to September between the hours of 11 and 3. And peak solar UV levels correspond to our summer months when people are more likely to spend much more time outside. And approximately 60% of the day's total carcinogenic radiation is received before 2 p.m. Although the UVR levels are highest in June and July, spring does present a unique exposure risk because people are often very excited to get outside and spend time, but haven't yet adapted to sun protection measures that they would normally take in the summer. Next slide, please. Exposure risks can greatly be reduced through individual and neighborhood level protections. However, some residents experience greater risks of solar UVR exposure than others due to unequal access to protection. So that means outdoor shade where they live, work, and play. Local shade is important because many residents cannot avoid being outdoors during peak UV hours, and there's evidence that shade provides more reliable UVR protection than sunscreen. The provision of built and natural shade, especially in high-use areas, can help reduce UVR exposure. However, neighborhood disparities in local tree canopy cover indicate that some residents may have a decreased capacity to avoid UVR compared to others, and further analysis is needed to better understand shade distribution and its impact on health equity. Next slide, please. So although changes in local solar UVR under future climate change scenarios are difficult to predict, and they depend on many factors such as pollution levels, stratospheric ozone thickness, surface reflectivity, and cloud cover, so it's very complicated. In general, we know that climate change is expected to increase solar UVR exposure in Durham Region, and it's expected to occur due to reduced overall cloud cover resulting from increased concentrations of greenhouse gas emissions. So we have reduced cloud cover combined with warmer days and people spending more time outside. So when you put these together, this is why we have a concern over increased UVR exposure. And it's worth pointing out that it's estimated that a 2 degrees Celsius increase in air temperature is associated with a 10% annual increase in skin cancer rates. Next slide, please. So what do we know about the health impacts of exposure to solar UVR? We know that frequent and prolonged UVR exposure can cause sunburn, severe eye damage, skin cancers, and suppression of the immune system. UVR exposure is the main cause of sunburns, and childhood sunburns may increase risk of melanoma skin cancer later in life. Although the incidence rate has decreased in recent years, almost 1/4 of Durham Region adults report annual sunburns, which is a major risk factor, as we mentioned, for melanoma. And the highest proportion of solar UV-related emergency department visits occur in the summer months from June to July, no surprise. Exposure to UVR can cause premature aging of the eye, which can lead to the development of cataracts. Repeated exposure can also lead to damage or cancers in and around the eyes. UVR exposure is the leading cause of skin cancer, and exposure to UVR from the sun has been associated with increased risk of developing malignant melanoma, which has the highest mortality rate of all the skin cancer types. Exposure to UVR is estimated to be attributed to an average of 2,540 cancer cases each year in Ontario, which makes it the leading cause of environmentally acquired cancer in the province. Incidence of skin cancer is expected to increase in Durham Region due to increased UVR exposure associated with warmer temperatures from climate change. Next slide, please. So it's important to note that provincial policies to reduce solar UVR exposure are very limited. There's the Occupational Health and Safety Act of Ontario, which requires employers to take reasonable measures to protect workers from workplace hazards, and this includes UV radiation. At the municipal level, although municipalities may include shade policies or guidelines in their planning documents, Ontario's provincial policy statements do not provide specific direction on solar UVR protection or shade provision. And then it's also worth noting that although recommendations exist to protect school-aged children from harmful UVR, there's no specific provincial legislation on protections in childcare, school, or recreational facilities. Despite this lack of specific policies, there are many resources and guidance documents, and in general, best practices point to the need for both personal sun protection along with built protection such as local shade provision. And we'll get into some examples in some of the next slides. Next slide, please. So what actions can support sun protection? For starters, we want to amplify health promotion to all communities about current and future UV radiation health risks and actions to reduce them. We also need targeted messaging to protect those most sensitive to harm from exposure. In addition to health promotion, there's also other important actions to ensure equitable access to sun protection, and you will see these actions are interdependent. So to begin with, we need improved understanding of sun exposure patterns among youth. In Durham Region, sunburns are more common among children and young adults than any other age group. So a better understanding of exposure settings as well as barriers and facilitators to sun protection are needed to design more relevant health communications programs and shade provisions that protect young people from sunburn now, as well as reduce the risk of skin cancer and eye damage later in life. Second, and related to this, we need to prioritize shade in outdoor settings used by children and youth. And this leads us to the third action, which are assessments of shade distribution and access. There's evidence that people readily use shade when it's provided. Assessment of shade provision is especially important in high exposure areas such as playing fields, transit stops, and active transportation routes, where people generally remain outdoors for extended periods of time. Local and provincial data are limited, but emerging evidence suggests inadequate shade and tree canopy cover is more common in lower income neighborhoods, so assessing shade distribution is essential for addressing health inequities. And finally, local tree canopy cover baselines and targets with a focus on equitable access would be beneficial. The Durham Region Official Plan calls for collaboration with area municipalities, conservation authorities, Indigenous communities, and the broader community to increase regional tree canopy cover, including identifying a regional baseline and target. Next slide, please. The good news is that harmful sun exposure is very preventable, and Durham Region Health Department already provides excellent information on its sun safety webpage, including information for work settings and school and childcare facilities. However, a public health survey showed that most Durham Region residents report they do not take protective measures from the sun. So there's still a need for more targeted health communications on risks and protections with an emphasis on forming sun-safe habits early in life. Durham Region also has a strategic green infrastructure and tree planting program and coordinates with local area municipalities to provide subsidized tree planting for residents. For example, between 2020 and 2022, approximately 770 trees have been planted, and these trees increase shade provision and also offer, as you know, many co-benefits for health, such as heat mitigation and flood mitigation. And finally, I wanted to highlight that some of the province's most progressive shade policies can be found in Durham Region. For example, the town of Ajax has a goal to create protection against ultraviolet radiation. Whitby's Climate Emergency Response Plan includes tree planting in high use and active transportation areas and plans for a minimum shade standard for public spaces. And the City of Pickering supports the planting of shade trees on school properties through the Environmental Schools Grant, and has also developed an integrated sustainable design standard, which includes shade and tree protection requirements. So these are just a few examples that support best practices by combining personal protection with built environment protections. Next slide, please. So as with previous reports in our series, this assessment will be posted to our webpage later today and shared with municipal and community partners. Our hope is that it will be used by decision makers to better understand the risks of solar UV and to promote education and access to sun protection with an emphasis of starting in early childhood. And we recognize that engagement with community partners and service agencies is an essential next step. And we hope that through engagement, community partners and service agencies will see that they play an important role in promoting sun safety, particularly for children. So to sum up this, once again, a very dense presentation, we have distilled it down into 4 key messages. Number 1, Durham Region should be prepared for an increase in solar UVR exposure among residents as climate change intensifies. Number 2, sun safety starting in infancy can prevent serious health impacts later in life. Number 3, equitable shade provision, especially in child settings, active transportation routes and transit stops can improve adaptive capacity. And finally, health impacts are severe, but once again, are often very preventable. Next slide, please. Sorry, next slide, please. And with that, I want to say thank you very much for your time this morning.
Thank you very much, Tara. Do we have any questions? I don't see any questions, but I do want to say, Tara, thank you very much. Just going to go back to my own profession of being a medical radiation therapist and the number of incidents of, especially with a lot of our farmers in our farmers community with the exposure that we have seen over the years. It's quite the education that we need to be doing for all ages. I'm going to probably say that I'm of the generation that we used baby oil as we were laying by the pool, and I think many of us are around the same age that can share that. And regret probably, but as a grandparent, just ensuring that the education not only to my kids but also about the grandchildren as well too. So on that vein of the education side of things, how much are we doing? And I don't know if you know this answer, but as with the newborns and with the public health, how much are we educating the new moms about the protection of towards the babies and that within our community? Are we doing any part of that? We know the answer? It's crickets in here. You don't have that. If you don't have the answer, it would be interesting if I can get that later on. But I think that, Chair Henry.
Madam Chair, I'd like to give you a motion to refer this presentation to the Committee of the Whole.
Happy to take that. Do we have a seconder? Councillor Anderson. That would be fantastic. All in favor? You're doing a roadshow, Tara.
Thank you. Be my honor.
Thank you very much. And I just lost my agenda. I just closed things out. But I do know we're going on to delegations. And within our delegations, the first individual is Ben Earl, the CEO from Feed the Need. Ben, come on forward. Good morning, Ben.
Morning. Morning. Thank you for having me. I appreciate the opportunity to update you on what's been going on this fairly, I think, pressing topic. As your own discussions, I'm sure, individually and as council have indicated. I represent Feed the Need in Durham and the network of organizations. So it's my privilege to present not just our perspective, but the perspective of that network of organizations, which I will speak to in my discussion. There we go. Just very quickly, many of you already know Feed the Need, but just to make sure that we give an update, we've been around officially since 2008. The work to establish the organization, though, started 20 years ago in 2005 by groups of local food banks who got together to find better, more efficient ways to gather large quantities of food to support the programming that they were running. There was food available. A lot of it was leaving our community at the time, going to places like Daily Bread Food Bank. Some of it was coming back to us, but obviously that's a fairly going to their warehouse in Etobicoke and then coming back to Durham, it wasn't very efficient. So the establishment of a local regional food hub to support our local food banks originally was the concept, and a community development process was established in order to create the organization starting in about 2005, and then the organization officially opened in 2008. Our purpose is to nourish our community and make local food accessible to residents who need it, when they need it, and where they live. We work with 70 community food programs across the community. These are programs, these aren't organizations, there's about 55 organizations, but some of them run multiple programs. These can be food banks, community meal programs, similar to what Durham Outlook for the Needy would do, or Backdoor Mission. It can also be pantries. We have pantries in some of the libraries, and other organizations run small pantries for clients to access. Some of the school programs that we work with as well do that. And then the Market Food Bank, which is a food bank that we run in locations in Oshawa and at Iroquois Park in partnership with the town of Whitby. And I'll speak a little bit to that. In terms of distribution, we distribute about $8.8 million worth of food a year. It's about $2.5 million is what we're going to hit this year. And I'll talk a bit about the growth that we're going to do. This is fresh, non-perishable food. We do also distribute non-food items, especially household goods, cleaners, baby products, and other items like that as well. We are the local representative, primary representative of Feed Ontario and Food Banks Canada. We've been established as the local food hub in that role. Our member agencies then are associate members of those organizations. What that means is that we act as the distribution hub for product that is collected through national and provincial programs. We act as the distribution hub for that product to come into our community and get distributed to where it's needed. That includes the provincial milk and egg programs that meat and poultry programs as well that are operated and facilitated by Feed Ontario, which is our provincial association. Getting right to the point, though, and I think we know this, but Durham, like communities across Ontario and Canada, is in the midst of an escalating crisis of food security. We've been talking about this for some time with many of you in the room, working on local responses and other responses, but we are dealing with a crisis of food insecurity. It's aligned with other crises around housing, addictions, and other issues that our community is dealing with, but we absolutely have a crisis of food insecurity and a growing demand for the community food programs that we support and that we operate across the community as a result. What this means is that many members in our community, more than ever before, are not having access to a healthy, nutritious diet. I want to be clear, this is not necessarily, they're not all necessarily reaching out to community food programs either. We are supporting the individuals who reach out, and usually the individuals who have the highest need, but we have many, many families in our community that are not reaching out for support, but they're also struggling with other levels of food insecurity, and that is an increasing challenge for them as well as they struggle to make ends meet. So food in Durham, Ontario and Durham, this is the stats around food insecurity. In 2023, there were just under 64,000 Durham households that were in some level of food insecurity across our community. This represented about 192,000 individuals. which was an increase from 22 to 23 of just over 10% in there. And you can see the growth since 2019. There was a bit of a dip in 2020, 2021. That largely had to do with the larger reductions in poverty overall, having to do with, frankly, with income supports that were provided as part of the CERB response. We saw poverty reduce overall across the country with those supports. But the minute those supports started to disappear and the cost of food started to rise in the wake of the pandemic, we started to see fairly significant rises in food insecurity. We are not alone in Durham Region. It is a national problem. Just under 9 million Canadians are food insecure now, which is, I've recently presented at a couple of international conferences. It's astonishing to some of our international partners that many Canadians are struggling, and we have our share of that in our community, and we need to find local responses to deal with that. This is the direct result of the sharp rise in the cost of necessities, in particular the cost of food and housing. We hear, and when I get to it, this is the number one reasons that people are using our programs, is these costs. And these food and housing, especially food, rose at rates much higher than all other inflation over the past several years. It obviously has all slowed down, but food inflation was at the highest levels that it's ever been in Canada for the last few years. Obviously slowed down, which is good, but the challenge with inflation, as we all know, is that prices go up, and even when inflation slows, they don't necessarily go back down. They stay at a certain level, and they're there. They're there basically to stay, and that's the challenge we have. And this has resulted in the rise in cost of food for families in our community. It increased by 36% from 2019 to 2023. For context, in the previous 5-year period of 2015 to 18, it increased by only 2% over that period. So you can see the dramatic and rapid rise in the cost of food in our community. This is driving those numbers of food insecurity and ultimately driving people to the programs that we support and operate. And this is the numbers of visits to our food banks in our network. We support food banks and meal programs. This is specific to the food banks. In the 2023 year, which is the last year we fully measure, we go by a fiscal year. We call it 2023, but it's April to March, essentially. There's 37,000 individuals visit a food bank, and they visited 268,000 times to food banks specifically. This number, the number of individuals is not increasing at such a pace. We've kind of hit around 40 to 45,000 individuals, but the number of visits continue to rise. We're projecting probably around 340,000 visits to the end of our fiscal year in March for this year. So that's another rise from 268 to about 340. Might be a little bit less. I've just seen the most recent numbers. It might be around 320, 330, but still a fairly significant rise again in the number of individuals visiting our food banks in our community. And the number the rise in visits since 2019 is even more staggering, if you can look there. Just prior to the pandemic, our network was supporting 75,000 visits a year. And the context is we've now risen from that number to just under 300,000 and probably just over 300,000 now in the course of 4 or 5 years, which is, for a sector like ours, that's an astonishing increase. And I'll speak a bit to the implications of that shortly. Just very quickly, so you understand who we're talking about. Out of all the individuals reaching out to food banks, 35% of them are children. That number has actually stayed very consistent in my 10 years with the organization. That number, despite the rises overall, it's always been between about 32 and 35% children and families reaching out to food banks. So we are serving a lot of families. And of those, about just over 60% are under the age of 12. So we are dealing with younger families as well in that. In terms of the adults, most of them are between 18 and 84, just under 60% are in that age range of 18 to 34. And despite what you hear from other communities, only about 7% of the individuals reaching out to our programs are seniors in Durham. And that has a lot to do with the demographic of seniors in our community. There is a need, I'm not saying there's not, but we're not dealing with higher needs seniors communities like you may be dealing with in places like downtown Toronto and others. We do have pockets of seniors that definitely need support, and we are there to work with them. And we do work with some seniors organizations to ensure that we're available. But in our community, seniors are not a major user of food banks. They may be reaching out to meal programs and other types of programs, but it's not the food banks they're reaching out to. And I do want to only because of commentary around this. Only about 9% of our users are post-secondary students. These are mostly reaching out to food banks that are on campus. We do support a couple of on-campus food banks through the student associations at Ontario Tech and Durham College. So only about 9% of our users are students. 8% are recent immigrants. This is a little bit higher than it used to be, and mostly because we did have a refugee response program when we saw the influx of immigrants from Ukraine coming into the country a few years ago. So we do support recent immigrants through some programs, but they're not, again, not a major group using our programs at this point in time. That may change as the overall situation in the community changes. But at the same time, 21% are from racialized communities. So we are, obviously individuals who are more marginalized, need additional support. And on the household side, 21% are single parents coming into our programs. But at the same time, the largest individual user group are single people. Individuals who are single, who don't have family ties, are the largest user group at about 40% of all households in our group. And I will say one stat, obviously people on social assistance are the largest user group, but for the first time we're exceeding 20% of our users are employed. We're at 21% of users of food banks have significant employment income. And that number's been on the rise for the last couple of years. So that's just the general overview of who these numbers are. On the other side to it, we also have our meal programs. We don't measure individuals that go to our meal programs. We measure the number of visits only to the meal programs. And we've seen an increase in meal programs over the last couple of years as well. 432,000 visits last year to meal programs, and we project this to continue to rise as well to probably just over 500,000 this year. So overall, we're looking at between 700,000 and 850,000 visits to community food programs just in our network in Durham Region, which for a community the size of Durham Region is a staggering number. Our meal, just for the data for all of this comes from a database called Link to Feed. This is provincially mandated. If you're part of the Feed Ontario network, you use this database. It's now nationally mandated. Food Banks Canada is rolling it out across the country. It is a specific database for tracking people who access food programs at the community level. So that's where all of our data and information comes from. It's what's used in the hunger counts. When Food Banks Canada or Feed Ontario put out a hunger count, they're using data from these databases. So just in terms of what we can do, we know food banks, and you'll hear this a lot, we're not the answer to food insecurity. We respond to food insecurity and we provide people with food when they are food insecure. We're necessary, but we're not solving food insecurity. And anyone who does this work, you'll hear, we don't claim that we do. We're feeding people who need access to food, and that's exactly what we're meant to do. The demand for that is growing in ways that are difficult to keep up with. You'll hear stories of food banks collapsing in some cases and struggling. We're very honest with that. We cannot meet the demand at the same level that we could previously. When I say we're seeing 340,000 visits to our food banks, every one of those people are getting food when they go to the food bank. What's changed is the amount of food we're able to provide. And no one is being turned away when they access a program in our network. They're getting less than they maybe did previously. So we've had to rethink what that means for us, focusing in on fresh foods, focusing in on household necessities to supplement people's diets so that they can walk away knowing that they may need to go to a grocery store or another food program, but their costs have been reduced in other ways. Our own food banks, we're striving for, right now, we provide about $100 to $150 worth of food, depending on the client and their family size. So we treat it like that. When we can give someone $100 worth of food, that's $100 worth of food that week that they don't need to buy at the grocery store. So that's how we're thinking about the work we do, and we're setting targets to increase that number. How can we give out $200 worth of food in our programs? But the amount of food that's required is substantial. When we were doing 75,000 visits, we had just under 1 million pounds of food a year. We're now doing 2.5 this year. Our goal is to hit at least 2.8 next year, leading to about 3.2 with our current infrastructure. We've had to grow. We've more than doubled our warehouse capacity and doubled our logistics capacity and added staffing to our programs. In doing that, we've been able to probably add about 2 million more pounds of food that we're able to distribute with our current infrastructure from where we were in 2019. That investment, though, is an ongoing cost of about $350,000 a year in terms of all the costs associated with that growth. That's just the new warehousing and the new logistics and the new staffing required. But we think that's a great investment because we're able to leverage that in order to provide more food. So when we advocate, we need to really think about how we're advocating to build our infrastructure and how we're advocating to change how we get food that's already available to our community into our community. We're not going to buy our way out of it. There are organizations, I have colleagues who I was talking to last week across the province. They're out of a $20 million budget, they're spending 10 on buying food. And they're the ones who are talking about collapsing because they just can't, they're trying to buy it, they're trying to chase a problem and they can't buy their ways out of it. And these are big organizations that have been around for a long time across Canada. What we really need to do is focus on policy change though. The immediate challenge is that we need to work on income security because people don't access food banks because there's no food available to them. They access food banks because they don't have the money to access the retail, access grocery and buy their own food. So we need to really, and we're advocating along with Food Banks Canada for a groceries and essentials benefit. Food Banks Canada has information on what this is, that it would be tied to the GST credit and allow Canadians who are low income to have more income for food. We are advocates of a national basic income. In addition to my role at Feed the Need, I also work as the general manager of Basic Income Canada Network. I've worked with that network for the last 5 years. I'm proud to say I'm one of the established leaders in the network in Canada, and we work very extensively on policy advocacy around what a national basic income could look like. We advocate for it at the national level, understanding that there are opportunities for provinces to engage in basic income programs and better income security, but that a national basic income, given the demonstrations of things like CERB, could be rolled out in a much more efficient and effective way for Canadians. So we're very much advocates of that as a way to increase people's income and access to food. But the work I've been doing internationally the last 2 years, traveling to conferences in Seoul and in Bath, talking to groups about this, is that while a basic income will reduce the depth of food insecurity, it will not eliminate it. Even the most generous basic income programs will not necessarily bring most Canadians up to the costs, the living wages in their community, or the cost of living in their community based on what we project those to be. So while a basic income will make people's lives better, it will not necessarily eliminate the problem of food security for the people who struggle the most. So we need to be talking, in addition to income security responses, we need to be talking about our food system. Bluntly, our food system is not designed to feed people in an affordable way. It is designed to sell the most calories possible at the cheapest price possible, which creates different types of food insecurity around health and well-being, but also affordability. We need to do things and find local responses to that so that we can advocate against that type of system. We're not going to change it. We're not delusional. We're a local organization looking for local responses, but our responses need to be understand that that's what we're fighting against. And this is where programs like our food bank come in, the Market Food Bank, which is a much more efficient model of food banking. It's based on choice. While we're seeing as many clients as some of our largest food banks in the network, it uses less food. And it uses less food because people are not going away with a prepackaged hamper of items that they may or may not want. They're leaving the food bank with items that they actually need and what they will actually use. So while it uses less food, that's good because in the long run, that means we can serve more people with the food that we're not giving out to individual clients. The other side to it is we're looking at farming. We are recently partnered with and we're taking over a vertical farm that's on Wilson Avenue. It's run by a company called Mighty Harvest right now. They're moving their facility from Oshawa to a bigger one in Ajax, and they approached us about 1.5 years ago to say, hey, would you be interested in taking over our farm? It's a 3,000 square foot vertical farm space in the south end of Oshawa, right down the street from our warehouse. We just started our first round of production on January 20th. Once it's up to full 5-day-a-week production, we'll be looking at between 700 and 900 servings of fresh lettuce at this point to families in our network. We got the first delivery a couple weeks ago. It's had a great response in our food banks. We're going to ultimately extend it to our whole network, but we're starting with our own food banks first. And the goal ultimately, once we do a year testing with Mighty Harvest, is potentially to move into other products beyond leafy greens. And we also have the expansion to double the capacity. Right now, the facility is only about half at capacity in terms of its growing. If everything goes well, we will double its capacity in the next few years. And that's the type of thing that we need to be investing in as sustainable food security programs. It's not going to solve all the problem, but it's allowing us to grow food for our community versus growing it for profit and bringing food into our food banks that's fresh and locally grown, which, given all of the context around us these days, the local product and doing things that we can do to make our community more food sovereign are going to be hugely important to addressing food insecurity. I'll leave it there because I probably already talked too long. And if there's any questions.
You never talk too long, Ben, and
Thank you.
always grateful for the information you share. And for anyone, if you have the opportunity to visit to the vertical farm, it's amazing. It's amazing what does take place within a vertical farm, and we need more of that, actually. Mayor Foster.
I'm going to unmute myself, and there we are. Ben, always, always good to see you. Ben, you mentioned a high percentage, 35, I think, of children using the service. So I assume that a parent is coming in that identifies they have 2 or 3 kids, and this is how you're tracking it.
Yes.
So it's families, and I assume families headed by, a single parent.
For the
If
most
I
part, yes.
Put the 2 together.
Yeah, for the most part,
Okay.
yes. That would be the trend. Yeah.
Okay.
It's not exclusively.
and-
there are a couple families, but for the most part, it is single parents and single mothers in particular.
Okay.
Yeah.
All right. And one of the easy things that the province could do, we've talked about ODSP for years. So you're talking about a basic national income or income guarantee. Have you put any numbers, or are you aware of any numbers that look at what ODSP would look like to get? I've got to guess that a number of those folks are using food banks because they just don't have money. Do you have any insight into that?
In terms of the amount that it would need to increase, or
Yeah.
in terms of people using our program, it's about of the people on social assistance, it's about 60% are on ODSP versus OW. So it is individuals with
Okay.
who are on ODSP. Now, those are not necessarily single individuals either. They are often families, heads of family, who are on disability payments as well, and they do come in with children and families. Yeah.
Yeah, I mean, that one almost seems like a no-brainer if we look at the levels, but great. Ben, thank you. Always good to see you. Madam Chair, thank you for recognizing me in the order that you did, given that I'm no longer on the committee. But I can't, apparently I just can't not hang out with you folks. Thank you.
You're welcome. Mayor Carter.
Good morning, Madam Chair. How are you?
I'm good. How are you?
I'm fine, thank you very much.
Happy
Ben, great to
Thursday.
yeah, happy Thursday. It's sure, happy Thursday. Ben, great to be able to hear from you. A couple things you made reference several times throughout your presentation, that when you talk about Durham Region with your colleagues across not only Canada but other places, that they're absolutely shocked at the numbers that we have. So the question has to be is why in Durham Region are we so much worse than the other places that you've had dialogues with? Is this economic? Is this I'm trying to understand why we measure so much higher than other places.
We measure higher in the growth in Durham. So we've seen other communities didn't see the same level of growth we did. Some did, but not as many. A big reason is the economic shift. We had a massive shift in the cost of living in our community, like others. But we're now seeing more and more. One of the trends we're seeing is more families that you would not normally think of having to go to a food bank. That's a trend that is a little higher in Durham Region than some other communities. So families that have dual incomes, families that have higher, and part of it is because they bought houses at the wrong time, frankly, to be completely honest, and then their costs have gone up. That was a trend affecting other communities. I would say we're parallel to other communities similar to Durham Region. The York regions and the Halton regions, we're similar in that sense because we've got similar types of development, but we're different because of that shift of more people are reaching out for support that traditionally wouldn't have reached out for support in a community like Durham. We're making part of that is because we've made ourselves known as a community and made ourselves available to more people. We haven't put restrictions. And I'm proud of that fact. There are other communities you'll talk about that have put restrictions on who can access their food banks, and that we've taken the attitude across our network that if somebody needs help, we're here to help. So part of it is also how we've structured ourselves and made ourselves available.
Okay, so so you spoke earlier on in regards to the economic challenges of living wages, and you're working on that.
Yeah.
But do we connect what our numbers here through Durham, through Feed the Need, in regards to our economic success or failure in Durham region?
Part of it is that gap in a community like Durham. So we know our labor market is very much a U shape now, right? Lots of jobs at that low skill level, but also low wage level, and increasing number of great jobs that require lots of high education. What was happening to communities like Durham, though, is those jobs in the middle they're not all gone, but there's less and less of them. And as a result, we've got a growing number of high needs people at that low end. We still have great manufacturing jobs, but not as many as we used to. And that used to be the foundation of our community. We're still seeing the effects of that shift in our manufacturing sector. We're seeing that because those jobs are shifting to things like retail and part-time work and things like that, which, again, that's not necessarily all bad. But when you see a shift of people who used to be in that middle group shifting to the bottom group now by simple circumstance of the economy, you have more and more people who are struggling to make ends meet in a way that maybe they hadn't in the past. Durham is one of the communities where that's happened worse than maybe some others. We're not the only one, but it's happened here. And it's happened recently here compared to some other communities.
But have those jobs not been shifted into logistics?
Some of them have, but logistics are they don't provide the same economic security as the manufacturing jobs they've replaced. They're a different type of job. So yes, there are jobs growing in those sectors, but there's not as many of them as there used to be, right? And they're not the same. They don't provide the same level of economic security as the jobs that used to be in the community that they're replacing. So yes, there are the jobs there, but it's not one for one in terms of the replacement.
Okay. I know you're a data guy, so I presume that you're collecting as much data as possible. So I'm going to presume that you probably have a report that shows us geographically where the challenges are based on the region of Durham. So I'm hoping that might be made available to us. And then also some of the trends in regards to male, female, anything to do with age groups, any of that kind of stuff. So it gives us a better understanding, a real kind of understanding of what the challenges are in certain areas. What's your advice in regards to, I understand the guaranteed income was a program that was started but then canceled, but it is part of a solution. You made the statement by your graph showing that in 2020, when the additional funding came in, we saw rates decrease. So I'm going to presume income is a big part of it. What else needs to be done?
We need to create a local economy that understands where the 21st century, frankly, and that includes the training programs. We need to understand that U-shaped labor market and create the programs that actually are going to get people from one stage to the other to increase their ability to take on the higher paying jobs. That's a piece of it as well. We also need to ensure that employers are creating good jobs in our community, right? It's not just a job, not all jobs are created equal. When we do economic development, we need to very much think about what is this development bringing to our community? What type of job is it bringing to our community? So the economic planning and development is a key part of that as well. The other side to it is we really need to, on the food security side, we need to really hone in on what does our local food system look like. We're blessed in Durham as being an agricultural community. We have that ability to really hone in on what does that mean for us. We need to make our agricultural sector economically viable, but we also need to think about how it can support us as a community and what does that look like. Because that's increasingly where we're going to be forced to go that way anyway. We should do it in a planned way. The vertical farming opportunity, we're taking it on, but we have lots of opportunity to develop that type of technology in our community in Durham. And it's a great way to expand what we already do as an agricultural community. So we really need to be thinking about how we plan economically and plan both on the agricultural sector, but also overall, because that will build a foundation in Durham that makes us a really strong economic community. And that's what it comes down to. So,
one of the surprising kind of reflections when you talk about the agricultural community and how large it is in Durham Region and what it provides, then it also has to be surprising that we do have the issues that we face based upon the agricultural community here. So is that a gap in regards to us not working with the agricultural community closer to be able to try and secure better partnerships here to be able to address it? Or is this because agriculture has contracts that those foods and their products are going somewhere else?
I'm not an expert on agricultural economics, but what I do think we need to do more of in thinking about food systems is create the opportunities for agricultural sector to have markets here. Right? That's what we can do. We can create the opportunity for those markets locally. That's what councils can do. That's what economic development can do, is create the opportunities for the agricultural markets locally and then work with the producers to take advantage of those markets. That's what we can do. Farms, especially the big ones in our community and some of the ones that are running amazing operations. I live right next to Algoma. We're not going to bring all of that home because we don't, but that's not a good thing either. We want them to be economically viable and strong businesses. We should be proud of the Algomas in our community that they're based here and that they are able to export nationally and globally. But that doesn't mean we shouldn't have a conversation about what we can do to help them keep more in our community. What can we do with those producers to keep more in our community and give them markets here?
Great answer, and I think that co-ops are more, farmer markets. Working with our agricultural community may be beneficial, and I know that there's efforts on that behalf. As usual, Ben, well presented, well researched, and we're grateful for the work that you do in our community. And it's an interesting time that we're living in, and I think that having your expertise at the table can only help us. So I wish you the best today, Madam Chair. That's all my questions, and I appreciate the opportunity to ask Ben some questions.
Thank you.
Thank you, Mayor Carter. So in the speakers list, I have Councillor Anderson, Councillor Neal, and Councillor Garrett. Councillor Anderson, please.
Thank you. Thank you, Ben, and thank you for an excellent presentation. You mentioned that working families are on the increase. Mm-hmm. It's around at what, 20% now? Or?
Yeah.
Okay. Are these folks that, I guess they work at retail, etc.?
No, not necessarily. The individuals who may be having part-time employment income have always been a component. We're seeing more and more people with full-time employment income, and they're not working retail jobs. They're working. The challenge we're facing is that we're seeing more and more people who you would never think need support. Families that are making middle incomes and decent incomes and dual incomes. They're not a critical mass of who we're providing, but we're seeing a growth in those people. So these are individuals who may look like many of our households in this room, right? Dual incomes, decent incomes, but they, because of circumstance around housing costs, around cost of groceries, around that we've all seen, right? I mean, my family of four has gone from spending $270 a week to $400 a week on groceries, right? So not all families can absorb that type of shift. And so we're seeing more and more people who you would not assume need support, who are reaching out for support. We know we're not seeing them all either. A lot of people are just changing their habits and buying less or eating different foods, eating more processed foods and things like that. So it's not just a matter of the lowest income people anymore. It's a matter of, this is why we call it a crisis. It's a crisis because it's affecting a larger and larger segment of our population and affecting people who we would not assume would need support like a food bank. And that's the challenge. That's why food banks are stretched. We were not designed necessarily to support that large of a swath of the community. We were designed to meet the emergency need of individuals struggling the most. We're trying to respond to it, but that's the challenge.
And you made a good point when you talk about eating habits, then that creates a health risk, and there's a trickle-down effect from that.
Yeah.
I can see the need. When I go into the grocery stores, the receptacles used to be brimming over with food. Now there is hardly anything in them. I guess folks can't afford to donate as much as they used to, and that may be resulting in you cutting back the amount of food that you can give to a family.
Yeah.
Is that correct?
I think we've been lucky because of what we do. We don't rely, just for information, we don't rely as much on individual community donations as a food hub. we rely very heavily on industry donation. Our biggest supplier is Loblaws warehouse, right? They drive 2 transport trailer trucks worth of food to our warehouse every week, right? So that's our big, we don't rely as much on the community-based donations. But our network does, right? We do not supply 100% of the food needed for any of the programs. We can't, right? We supplement what they do. Our member agencies and the smaller programs have definitely seen a reduction in the food because of the drop in community-based donations. Yeah.
Okay. Through the chair, one final question. You mentioned basic income. You are on a committee that's trying to.
I'm on, well, I work with the it's a national not-for-profit organization that advocates and does research on income security and basic income. So I work with them, yeah.
Is there an attraction?
There is. We have ups and downs. The last few years there's been a lot of advocacy because CERB really demonstrated what you could do and the impacts of it. We're in an election cycle, both provincially and federally, so we're in a bit of a lull. But there is definitely opportunity to have those discussions, and they're ongoing.
Yeah, they're needed, and it's a worthwhile program, I believe. So again, thank you and your team for all you do, and
Thank
we're
you.
here to help in
Thank
any
you.
way we can. Thank you.
Thank you.
Thank you. Councillor Neal, please.
Yeah, thanks very much, Madam Chair. That's very interesting to hear that. But I just want to bring it to this committee's attention that Derek Stevenson, the founder of Vertical Farming and the Mighty Harvest in Oshawa, is a member of the Durham Agriculture Advisory Committee and has been for a few years now. I nominated him when the nominations were out there for that committee. So he's just a young guy, and I think he's done a great job. And I'm glad that Ben has talked about it because he adds a lot to that Durham Agriculture Advisory Committee. I thought I'd just add that in, Madam Chair. Thank you.
Thank you very much, Councillor Neal. Councillor Garrett.
Thank you, Madam Chair. Just checking, is this the right sound okay?
Yes, it's perfect.
Okay, thank you.
Where'd you go? Hold on a sec, Councillor Garrett. Can you press the button again? All right, try again.
There we go. Okay, thank
There
you. Well, my mistake at this end originally, because I'd had the applaud sign going the whole time during Ben's presentation. So as much as I liked it, that's not what I meant. So Ben, thank you. It's certainly a pleasure to meet you. You may not be aware, we did a community survey with significant help from Regional Social Services to get a sense of the social services that are required here in Uxbridge. And in that, the top 4 categories were lack of affordable housing, which the region has stepped up for and made a contribution towards a partial solution with that, food insecurity, homelessness, and mental health and addictions. So with the help of the region, we've taken some action related to homelessness services here. And just this week, I've had some discussions regarding mental health and addictions, getting lots of support on that side. Food insecurity is a tough nut to crack and what we can do. I heard a lot of references of the great work that your organization is doing. I'm interested in what's happening here in North Durham and then of course, in my backyard right here in Uxbridge.
So I will say, honestly, North Durham, other than Brock, is a tough nut for us. There's established organizations in both of those communities that have not joined our network, despite several conversations over the years about how we can work more closely together. We will absolutely support them when they call, but they're not officially part of our network. We recently had conversations with, I believe Loaves and Fishes, probably about a year and a half ago now, about how we could work together, and they ultimately decided to continue on their own and not become part of our network. We're absolutely, part of our growth plan as an organization is to expand into communities where we don't have as much coverage. And Uxbridge and Scugog are actually top of our list for communities where we don't have as much coverage. We're looking for opportunities to move in those communities. We've had a great relationship with the town of Whitby in expanding services with our partners there. And we're looking to how can we implement that model as an organization, but also in partnership with the community, because that's what Whitby is. It's a partnership with the community. It's not just Feed the Need coming in and doing something. We're looking for opportunities. So my answer is we don't have great coverage as a network in those communities. That doesn't mean there's not good organizations doing work there. They're just not connected to us. We would be happy to have those conversations about how we can expand our supports and our work into those communities and work with them to grow the services that are available locally. That's absolutely top of our agenda, and it's part of our plan as an organization.
Okay, that's good news. Didn't know that those challenges were in place. I'm working my way down through the list, although, as I said, food insecurity was number 2 on the list, but I've got some quick help on the other topics already. Let me help you there. Let's connect and see what I can do as far as getting in. I'm not directly connected with Loaves and Fishes, but certainly have the contacts in there, so I can at least facilitate a discussion. The other part you talked about was, the vertical growing, the vertical farms, and I don't think you'd have an answer to this. Again, it sounds like it's a bit of a challenge as you get up to North Durham, but we're an ag community, and our farmers are very generous. They've got a lot of product that comes to farmers markets, and of course they go to the big retailers as well. But I suspect, in fact, I've seen in some of the ones where they have their shops on their farms where they sell the not blemished, but less perfect fruits and vegetables. I suspect they'd also be receptive, not to put words in their mouth, but also to make some of those available, especially if they knew it was going to help you, help us in North Durham. So when we connect, let's talk about how our ag community can help you in general, and then feather that into how it can reciprocate back and help us here in North Durham.
Yeah, we'd be happy to. Agriculture and expanding with farms is part of our strategy as well. We already do work with some great partners in the sector, but we've recently set up an education campaign because there is a farmer's tax credit for farmers who donate to community farm programs. Yeah. We've set up an education campaign to make sure that's aware. Our goal, though, is to keep that local, right? We want to be the organization that collects that and brings it into our community. There are others who are absolutely great at collecting food in communities, but it doesn't necessarily stay local. And our job and our goal is to keep those resources local and build our infrastructure both as an organization, but also as a network to be able to do that. So happy to have those conversations and see what we can do in Uxbridge.
Sounds good. Thanks very much. Thanks, Madam Chair.
Thank you.
You're welcome. And Councillor, I would actually be more than happy to give support as well too, because the relationship that we've built with Feed the Need, but also with our food banks and with our local ministries, bringing them together the last 2 years, it's been very helpful to help to come to solutions. And now that they're not individually working on their own in their own silos, they're now collectively working together and come to the realization that they're all struggling with the same thing. And it is one that I think that there's been great success, and like in many cases have been honest with Ben as well too with their struggles. Which the conversation has been a great one, and I think our next roundtable is coming up in the next month. So I would welcome any members from Health and Social Services to actually be present to hear the dialogue that does take place, because our agencies and our supports are very open with their struggles, and Ben, it's been wonderful in helping to bring solutions. So thank you. Councillor Brenner.
Thank you very much, Madam Chair. Ben, in the city of Pickering, in particular, we've had a number of food drives. You're aware, a team that's been out there working. For a while, there was concern that the amount of food that was being collected in Pickering wasn't coming back into Pickering. What's your thoughts on that, and how is it being rectified?
So the food that's being collected, we don't run food drives, so I want to be clear on that. We run in partnership with organizations, but we don't initiate community-based food drives. So often what will happen is a local group or a business or we'll get together and do a food drive. So what you're talking about in Pickering is some organizations who know Feed the Need have collected food in that community on behalf of us. We do support St. Paul's on the Hill. They're a member of our network. We are now, they've been a member of our network for a while, but only this year did they start actually taking food from us. They were a part of our network for tracking and other reasons. That's why they joined originally. So they do get food from us now. I think we're up to, if I can look at my numbers here for St. Paul's on the Hill, we're up to, so far this year, since April, we're at about 50,000 pounds of food to them. They'll likely top 100,000 pounds of food this year and then increase that next year in terms of the amount of food that we go. That's because we're ramping them up. So we do send a decent amount of food to them. They're in the top level of food banks in our network in terms of, well, they're one of the largest. If they're not the top two, but they're certainly in the top 3 or 4 of food banks that receive support from us in our community. So we do return food back to the community. They also are part of our milk and egg program. They receive about $10,000 worth of milk and eggs a year from us, that we purchase that and then we send it out to our network. So they receive that directly from us at, other than their membership fee at no cost to them. They do pay a membership fee. So we do our best to get food into Pickering, but the challenge is there's one organization there. What I do also say, and we've had this conversation with the organizations there, a lot of the residents in Pickering are not staying in Pickering to get support. They will go to an organization in Pickering like St. Paul's on the Hill, but then they'll also go next door to Ajax, even onto Whitby. And our job is what we were established to do was get food to where it's needed most based on the number of people visiting organizations. So our network is designed to get the food to where the most clients are. That's exactly how we do it. So if there's Pickering clients going to other food banks, they're still being served. They just may not be served in Pickering. We also, though, because of this, if someone approaches us and wants to do a food drive and it's in Pickering, it's in Whitby, we will, depending on what they're doing, we will encourage them to connect with local organizations. We don't collect, for the most part, at local grocery stores unless the grocery store themselves reaches out. The bins that you'll see in grocery stores, most of them across Durham are not going to feed the need. In fact, I would say almost all of them aren't going to feed the need. Maybe there's 1 or 2 stores that collect for us because we want that food to stay in communities. We want those donations to stay local. It's not worth it for us to take that food, bring it back to our warehouse and send it back out. So we do our best to encourage the local community food drives to stay in those communities. We're also, though, if someone approaches us and runs a food drive and it's on their own, they decide they're going to run a food drive for Feed the Need in Durham, we often don't know about it until it's already in full motion. They often just come to us and say we've done it. So we work very hard to try and keep the food in communities. It doesn't need to come to my warehouse for us to make sure that our job is to get food where it's needed. So we are having those conversations with our partners in Pickering and Ajax where this is where it's been emerging as a challenge. But the issue is it's a new relationship with St. Paul's on the Hill as well. Although we've worked together for years as partners, they've never been officially part of our network until the last couple of years. So I think we're going through some of the growing pains of what that is. A lot of the other organizations that are the same size as them have been working with us since we started 20 years ago, right? So whereas St. Paul's on the Hill has not. So there's some growing pains there. Our job, though, is to get food where it's needed most and keep it in the communities that make sense. But at the same time, our network is serving Pickering residents, not just the organizations in Pickering. So we have to be cognizant of that as well, that food collected in Whitby is also serving residents from Oshawa and Ajax because they're coming into Whitby. Same goes for the other municipalities in our community. So we're doing our best to build that relationship and make sure that we're not, if what we want to is make sure people are very clear where their food's going. If they want it to stay in Pickering, we will build a relationship with them and the organization in Pickering. If they want to generate generally to our community, the region, then we'll work with them on that as well.
Great. Thank you very much, Ben. And thank you for the fantastic work that you do and your organization. It really does make a difference across the entire region.
Thank you.
Thank you, Councillor Brenner. Is there further questions? I'm going to do 2 things. I have a couple of questions, but in the end, I'm going to ask if possibly Chair Henry can also motion that this be brought to Committee of the Whole, but the March. So moved by Councillor Chair Henry, seconded by Councillor Dyes. I think it'd be very beneficial, and our February Committee of the Whole is very full, so we know that March is one that would hopefully you would come back to speak to all of Council as well too.
Great.
All in favor? Thank you very much. Your whole slide deck, it's the very last slide, very last paragraph.
Mm-hmm.
The work starts at home.
Yes.
It starts at home in Durham. where we work together with producers, processors, retailers, government, community organizations, and residents to identify community-based actions that can support food security and a sustainable local food system. If you were to break that down into to how we as government can help to do more, educate as well too, because I think that's a big component of it, what are some of the key priorities that we should be putting into place for this?
Well, the first one, I'll reiterate what you just said, education. Learn about what we do. I don't mean this is not out of our own hubris, but we represent almost every community food program in Durham in some way. Not all of them. Absolutely, there are some very good organizations and programs that aren't part of our network, but 55 organizations are. And so we as a network know what's going on. We know what the solutions are. We know what the challenges are, and we know how to, if we don't know the solution, we probably have the ability. So listen to the local organizations, which you've done in Whitby. We're going to be doing it in other communities as well. Listen to them and bring us to the table where you think we can help, because what we do is build the networks. So understand what we can do, which is build the networks and build the connections. The other part is we need to understand that we are not going to solve this by being reactive. So government needs to be as thoughtful on this issue as we are on other issues. Reaction is what's getting our colleagues around the country in trouble when they're spending too much money on things like trying to chase the rabbit down the hole, buying more and more food. That's part of the solution. We do want to purchase, but we need to be targeted in how we do it. But so help us find sustainable solutions. Give us the opportunities. An example of what's gone on in Whitby, help provided us space. And it's not just us, I mean us as a sector. Provided us with the space. Gives us a low-cost entry into doing a service in the community and bringing it there. It allows us to do it faster than if we had to source it and rent the space and things like that. Allows us to do it in partnership in a space that I think is really valuable. That's the other lesson I would take, from Whitby, is we put it in a community space. We didn't hide it down a back alley. We put it right in the heart of the community. And that is hugely important to what we're dealing with. This is a community issue and it's nothing to be ashamed of, right? People who are struggling should not be ashamed that they're struggling. We need to show them as a community that we support them. So that's the types of things government can do, is help us make awareness, educate, learn what we can do, hear from your local organizations like Councillor Brenner was talking about, learn from what's going on in your local communities, bring their concerns forward, have the conversations about how we can work together and ask the right questions. Those are the things. But the other side to it is the economic development stuff I said in response to Mayor Carter. Help us build the markets for local food. Help us understand that this is not just an issue of food insecurity, it's also an issue of climate change. The issues that we're facing these days with the threats from our southern neighbor, we don't know where they're going to end up, but they very much bring home the issues that we're potentially facing, that we need to understand how we support ourselves locally. This is not a new thing, but we need our council and our leaders to understand what that can be as a community, because it doesn't just help food security, it helps many other things. So that's what we need our government leadership to do. And I've been very lucky. I feel almost uncomfortable. Many of you in the room ask me. I'm the first one many of you call, which I appreciate. And I'm glad I have the platform, but I take that very seriously, given that I don't just represent Feed the Need, I represent a lot of other people. But call us and ask. Your community organizations probably know what the solutions are, they just might need a little help getting there. So just call and ask. We do know what's going on. On the policy side too, we know the solutions that we could be looking for. We know the types of things we're asking for that may be different from what council thinks is the solution. And I'm not saying that as a slight to anyone. It's just we know what's going on. We know what we're asking for. We know what can help us best. And when I say we, I mean the whole sector, not just Feed the Need. So I think that's the thing that you can do is help us lead towards those sustainable solutions.
I think one of the things in the past year for myself is just the listening and to hearing what the struggles have been.
Yeah.
Even just with what we're experiencing with to the south of us and visiting to the businesses in our community, and even just the last couple of days I visit some of our businesses. The struggles of what they've been experiencing is just the getting people to work.
Yeah.
And keeping people to work. And some of the organizations, some of the businesses have well-paying jobs, they have pensions, they have benefits, but they can't keep
Yeah.
people in place because they don't want to stay in place for some reason or another. So it's just, and even some of the post-secondary relationships between, it's just not training the individual for the proper job market that we have in place. It's been a lesson. The other side is on the, with our grocery stores. I took the opportunity last summer to go visit each one of our grocery stores in Whitby and to understand, did they understand what that bag that you purchase for $10
Yeah.
and what they place within that bag is potentially getting thrown out
Yeah.
because it's not like providing the proper
Yeah.
nutrition to the clients that are picking up the bags. And I know that we have seen a transition and change in some of the food banks within Whitby, but the food pantry, and I think that is one that it's helpful for people to understand that the food pantry brings dignity. It gives the opportunity for people to select what is within their dietary needs.
Yeah.
And also having
Yeah.
the fresh fruit and vegetables present as well too.
Yeah.
So
Yeah.
I welcome you
So,
back to
thank you.
Committee of the Whole for March.
Perfect.
Thank you for your partnership within
Thank you.
Whitby and across the region, and for your advocacy for what you do and how you help us out. And
May I, just one more thing in response? You talk about the labor market. Our sector struggles with the exact same things as businesses. And tomorrow I'm actually, in one of my other roles, I'm the president of the Clarington Board of Trade. I'm facilitating a conversation with the not-for-profits in Clarington, specifically around this issue of labor. If your businesses are struggling, so are your not-for-profits. We just often don't get lumped into the conversations about labor market because of how we operate. So that's another thing that you can do, is talk to your organizations, not just the food banks, about what they need in terms of human resources to do the work they do. So thank you.
and I had a roundtable with our non-for-profits this past year, or 2024, and 65 non-for-profits were present. And that was generally the big concern about the supports, the actual physical being of having individuals around to give that support. That just doesn't seem to be there anymore.
Yeah. Thank you very much.
Yeah, thank you, Ben.
Thank you.
Next, we have Patricia Conlon. Patricia, and Foundations for Healthier Communities. Good morning.
I just want to confirm that I have to 10 minutes as well. Okay, thank you. Thank you for the opportunity to speak today on such an important topic, the health of our communities. I'm here to talk about some significant news and shifts in public health that need attention by this council and community. All over the world, a message of urgently needed health reform is being echoed. New appointments like Robert Kennedy Jr. in the US are making it a top priority to tackle the growing chronic disease epidemic, as well as corruption within our public health agencies. In Canada, we hear of suicide, chronic illness, skyrocketing cancer rates, and drug addiction, and increases in all-cause mortality. It's a very concerning time, and I think we need to face these issues directly with honesty so we can solve them together. Families are struggling to put healthy food on the table, as Ben has highlighted, and I fully support his work. And young people are having even fewer children due to the cost of living. Many people are depressed and feeling overwhelmed. This is a bad situation and we're in a crisis. It's time to look at some of the root causes seriously and with an open mind. And I hope that I will achieve that today, reaching to you as a partner, not in opposition, but together, so we can look at some of the root causes and maybe take steps to address them. As a concerned citizen, I'm also a registered holistic nutritionist, and I've written 2 books on health, regenerative farming. I have deep partnerships and care for the farmers in our community, and I'd be willing to work with Ben's organization to help that become a success. Food and what we put in our bodies is so critical to our health, and the fact that so many people can't access fresh fruit and vegetables is such a tragedy, and we need to solve that. There are many ways that we can do that, but there are other issues that we must face with policies that have been causing harm to human health, physically, mentally as well. I want to start with something that's, potentially controversial, but please hear me out, and that's examining fluoridation policies in Durham. And again, shifts are happening all over the world. In the past, what was accepted is understood through new science to not actually be good for human health. And it's the same with fluoridation. In the past, the region may have decided to fluorinate water to prevent dental decay based on public health authorities who claimed this treatment was safe, effective, and legal. However, the truth is all three claims are false. The truth is clear. This practice has been scientifically proven to lower IQ in children and damage permanently fetuses of pregnant women. Last fall, a U.S. federal court ruled against the Environmental Protection Agency after 7 years of comprehensive research, and top experts testified that fluoridation poses, quote unquote, an unreasonable risk in reducing IQ in children. The effect would be similar to that of lead. The claim that fluoridation reduces tooth decay has also been proven to be completely false. I won't go into all of the evidence, but I will provide it. In addition, it's actually illegal for a medical treatment to be administered without informed consent and with improper dosage. And this region bears full legal responsibility for harm. A better path forward would be to put a moratorium on fluoridation and review very, very compelling scientific material. Canada is the fourth most fluoridated nation in the world, but many nations and many regions are taking steps to remove this toxic chemical from public water to improve public health. Without health, physical health, and mental health, we don't have a productive workforce. And there are areas where we can greatly improve public health through policy. And that's what I'm hoping to inspire today. Another serious issue that farmers in the community where I live have spoken to me about in confidence are grave concerns about the sewage sludge that's being put on farmlands called biosolids. Significant studies, one of them through University of Ottawa and other through Guelph, have proven definitively that anaerobic processes do not destroy harmful bacteria and other toxins, as many as thousands of chemicals. The biosludge created from anaerobic digestion plants are misleadingly being sold as eco-friendly fertilizer to unsuspecting farmers and being spread on farmlands. This is also not being done without proper testing, and many don't realize their land can never be zoned organic after putting this on their land. These biosolids should not be spread on fields where edible food is being grown due to coliform contamination and more. There are other countries that have banned this practice and are using incineration methods instead. And this needs to be looked into, particularly or at a minimum for productive farmland. Another health concern that's easy to investigate and make positive steps towards solving is that of toxic chemicals. For example, and I am a very, very strong advocate for our farmers and farming community and food security, but Roundup with active ingredient glyphosate is still being sold in local stores for residential use, despite overwhelming evidence of it killing bees and other pollinators and causing cancer. At a minimum, we should protect residents from this harmful chemical. I wanted to add on the first presentation about carcinogenic UV radiation that I have a different point of view that needs to be listened to and considered. There is an overwhelming number of class action lawsuits against a lot of the major sunscreen brands. Sunscreen, the toxicity of this on babies, is not something I would advise. Protecting babies from the sun can be done through other methods. And sun, we all need some sun. But the carcinogenic chemicals in a lot of these sunscreens are actually causing the cancers, not the sun. And you may disagree with that, but the truth about the toxicity of a lot of products is being highlighted now through brave individuals like Robert Kennedy Jr. And so looking at a different approach is something that I'm hoping to inspire here. I want to just go over as well so we can learn from our lessons. And this is as a partner and a friend. I'm not an adversary. Because we do need to learn from our mistakes, and everybody makes mistakes. But to have a healthy community in the future, we need to learn from the COVID and net zero policies. This region seeks to achieve net zero by 2050. This policy of zero carbon, just like the policy of zero COVID, is unachievable and has already resulted in massive financial and mental stress within our community. This whole idea of demonizing carbon is ridiculous. It's a life-affirming molecule and it needs to be seriously reconsidered. I applaud the idea of planting more trees in urban settings and also protecting our green spaces instead of building high-rises. But health policies dictated at the regional level during COVID were harmful, and people need to accept that responsibility and apologize and move forward in a different fashion. Lockdowns and mandates did more harm than good. And the truth now is very powerful coming out. Countries all over the world, certain states, and even recently the province of Alberta have called for the experimental vaccines that were provided to be withdrawn due to injuries and lack of effectiveness. There's even serious evidence of contamination as identified by Canadian scientist Dr. David Spiker. So it's time that we stop following unelected foreign officials when we implement health policies and seek those alternative views that we may disagree with, like mine, on policies going forward. There's a lot of things going on that are negatively impacting health. However, the good news is we have turned a corner. Enough brave people have stood up all over the world, and their voices are finally being heard. I think we have a chance to chart a much better course in the future with health policy. And that's by working as well with dissenting voices to make sure we have adequate food, health, fresh vegetables and fruits for our communities. I'd like to recommend the following action steps to address current health policies, and it's by no means a comprehensive list. I'd like to see people investigating here fluoridation. I can provide and I will provide comprehensive evidence of harm along with experts like Dr. Robert, who I've been working with through Fluoride Free Network. He's been at this 20 years and he has incredible love for his community and country. So a moratorium on fluoridation pending in-depth potential review.
Patricia, are you almost finished? You're at your 10 minutes.
Yep, I'm just finishing the list. Withdrawing the COVID vaccines from pharmacies and drugstores. Looking into certainly reducing the materials that can go in the green bins as a start. The products that were listed recently will not be properly composted using anaerobic digestion. Study incineration for future use. Prohibit residential use of Roundup, Astrazine, and other toxic herbicides. Withdraw from the Partners for Climate Protection, ICLEI, Local Governments for Sustainability, FCM, Federation for Canadian Municipalities. And focus, I think that the real focus is the basics. It's not complicated. Focus on physical food and health by supporting local farmers and also helping educate people about growing their own food. They had victory gardens after the World War during the Depression. My father used to tell me.
How much more do you have, Patricia?
Pardon me?
How much more do you have?
Just this, I'm just reading this last point.
Okay,
Thank you. We could also promote safe remedies during flu season. Provide vitamin D at almost no cost to our elderly care homes. 80% of people who got COVID, a comprehensive study showed, were deficient in vitamin D. That's cost almost nothing. There's many, many good ideas I could go into, and I'm passionate about this topic. It's why I've committed myself to a path to help our communities. It's because our physical health is under assault, as well as our mental and emotional health, and these things all can be solved through good leadership and good policies. Thank you.
Thank you very much, Patricia. And I think that your comments specifically around the mental health and also around nutrition is one that we all can collectively share are key important to all of our well-being. So
Thank you. And I've forged excellent relationships with the farmers in our community. I wanted to reach out to Ben as a partner. I'll absolutely help to connect him with some small scale farmers. There's programs like Just an Acre that are I'm helping to lift off that will encourage profitability. We need our farmers to be profitable. I mean, that's a really important point. If we make the cost of being a farmer so burdensome, then they won't be able to grow all that wonderful food we need to be healthy. So let's lift up farmers in our community. Let's make food affordable for everyone. Let's encourage gardens and good health. Be a steward of good environmental health. Look after our lands. Clean up some of these toxic chemicals in our air, soil, and water. And we will see this community flourish.
Thank you, Patricia. Do we have any questions? And any online, any questions? Seeing none, thank you, Patricia, for your presentation. And do we have a copy of her notes as well,
I
too?
will send it.
Okay, thank you.
I'll send it, and I have other reports I can include for the council.
Okay, thank you very much.
You're welcome.
So we have nothing under health, we have nothing under social services or advisory. Is there any other business? Mayor Carter.
Once again, Madam Chair, thank you very much. Interesting delegations today and great subject matters. Madam Chair, as you were aware, there was an announcement that Heart Hub has been allocated to the region of Durham. I'm wondering if I might be able to ask some questions in regards to it. So one is, do we know where this Heart Hub will be located?
Commissioner, or do you want me to ask Lisa to, Lisa, do you have the answer for that? Because I know we asked the same question Monday night.
I know. That's why I'm asking. I think it's important.
The Commissioner will respond.
Thank you.
Great.
Through the chair. We are currently working on the plans for that, Mayor Carter. We haven't, there isn't an announcement yet on the location.
So we can't, that there's no, DCHC was awarded the Heart Hub and is the representative of the Heart Hub, but it's not allocated to a certain community?
It's been allocated to the region of Durham, not to a particular community. So DCHC is working with us as a partner in the region of Durham.
Okay, all right. That's interesting because when I spoke to the Minister of Health, that wasn't the understanding. So that's new information. So I appreciate that, Commissioner. Number two is who will manage the Heart Hub, the day-to-day operations? Sorry.
We're getting the answer here.
Great, thank you.
I'm going to just pass that over to Lisa. She'll give you more details on that, Mayor Carter.
Great, thank you very much, Commissioner.
DCHC is the lead for the project, and so DCHC will determine which agencies and community partners are part of the initiative, and so those details would be worked out in process.
Okay, Lisa, by the way, Lisa, thank you very much. I'm going to ask you a couple more questions if you don't mind. So DCHC is the lead agency. They're responsible for creating the partnerships and the deliverables under the legislative requirements. Is that what I understand?
Yes, under the provincial requirements.
Okay, and so they is this just from the ministry a flow through from DCHC to the region? The region then would provide the services and then report back up through DCHC and then to the Ministry of Health?
DCHC is the lead agency for this project that is funded through the Ministry of Health. They are the agency that is leading the planning and development of the project.
Okay, So under, Lisa, under what you understand from the Heart Hub and the legislative requirements of the model itself, how is DCHC going to be able to deliver these services without violating the legislation that they've put in place?
They're going to plan and deliver a Heart Hub that follows the guidelines and requirements set out by the province. So they will have a transfer payment agreement with the province, just as we do for funding streams, and they will be required to meet those obligations based on the agreement they sign as the lead agency. And then they would need to report back up on any KPIs or targets that exist within that agreement.
Okay, so that means that their harm reduction program would cease to exist as of the time that the agreement is signed with the Ministry of Health and DCHC in the region. Is that correct?
Harm reduction programs are not to be funded under Heart Hub funding according to the guidelines and requirements that were set out. Our understanding from the Ministry of Health, and I'm not speaking for DCHC, I'm speaking as a partner who was involved in the proposal development and also reviewed them as a rep for the system management side of that review and consideration. Harm reduction practices and are not ending in the province according to the ones that are funded under public health and through agencies under other TPA agreements, so transfer payment agreements. Heart Hub funding that is received, whatever that allocation is annually, cannot go to support harm reduction funding as part of the Heart Hub project.
I really appreciate your explanation because I think that brings clarity in regards to what they're doing today and what's required under the Heart Hubs. Who will be ultimately responsible to be able to meet the launch date of April 1st, 2025?
So the agency that are for all of the Heart Hubs, agencies that hold the TPA will have to meet the requirements of their TPA or exceptions or changes that are included through the ministry. And I guess the establishment of those TPAs and execution of them and timelines around that process may also determine what actual full rollout dates can be. But that is from my experience as someone who does manage and look at transfer payment agreements from the province and the federal government at times.
So I want to get a piece of clarity. So DCHC will be directly responsible for the deliverables, the criteria that is associated with the Heart Hub. They would be directly responsible in regards to the deliverables on that, not the region of Durham. Is that correct?
The region of Durham is a partner agency on the application, but we wouldn't be responsible for reporting to the Ministry of Health on the transfer payment agreement that would be held between DCHC and the province of Ontario.
Okay, so we don't know where the location is at this particular time. We understand that DCHC is a lead partner. The region of Durham is a partner on it, so I'm going to presume they're going to use your expertise in regards to delivering the services because DCHC does not provide most of the services that are required under the Heart Hub. That's clearly understanding. So my question being is, and I don't know if you can answer this, Lisa, or somebody else might be able to answer it. Why partner with an agency that doesn't have the expertise in this critical, complex health issue to be able to get the Heart Hub in the region of Durham? I'm trying to figure that one out.
So our Heart Hub planning process here in the region of Durham included working through Lake Ridge Health's Integrated Planning Committee to bring together all health service providers in the region. We worked through the process and what the guidelines included, what opportunities existed in the region, and applications were developed in tandem and coordination looking at the expertise and work that all of the agencies at the table were bringing together. And so applications did move forward based on the partners around the table, what commitments could be made. It was a collaborative process. In the region, we did really look at who and what agencies were actually equipped to be health service provider agencies and lead a heart hub. So serving specialized populations and doing work in the community alongside us now.
So it sounds like the region took quite an active role in regards to trying to put this together to get this opportunity. Is that fair?
The region took a role based on the Heart Hub proposal and guideline documents that went forward that said the system manager for housing and homelessness should be involved and consider reviewing and supporting the applications to be produced.
Okay, so an obvious question would be, why wouldn't the region just take the lead on this and put the application under the region without
Mayor Carter.
it going to PCHC?
Yeah, just Mayor Carter, just within terms of the application, the region couldn't make the application. It had
Okay, that's why I'm asking these questions, Madam Chair. That's why I'm looking for clarification. So the region that is a specialist in health, social services, housing, is not entitled to be the lead on it, but an agency that provides none of those services is. So I just want to try and get a clear understanding of that.
And I think that may be a conversation with our current MPPs and candidates right now, because I know that there's been other applications.
Listen,
I understand, Mayor
with
Carter.
the Minister of Health, the Associate Minister, the Premier, Chief of Staffs on all levels. So we've had some spirited conversations. How much is the allocation per year in regards to this program for the region of Durham Heart Hub?
I can't actually, I wouldn't, I have to look it up and get back to you. I know it was included in the news and media releases for the Heart Hub proposals. And so I don't have it right in front of me.
So I'm under the impression that it's between $18 and $20 million over the 3-year period. That's my understanding. Is there
get the information for clarity?
Yeah,
Carter.
Great. So my understanding is this is for 3 years. Is that what the obligation is under the Heart Hub? Is it a 3-year commitment?
That's what the news releases and guidelines that were made public included. Like that's what we were looking at in the application process. I am not.
Okay.
I'm not able to speak to the TPA agreement that would exist, like what the final components are, because I don't have that information for you. That would be the lead agency for the project. That would be.
So would that be advisable to ask DCHC about how long the agreement is?
If you have questions of the lead agency, then you can connect, with DCHC.
Yeah, okay. So, Madam Chair, I appreciate you giving me the opportunity to ask these questions because, I am confused because the reason that I'm not at the day of the announcement, there was no questions that were asked or answered publicly. We still don't know where this Heart Hub is allocated. It could be up north. It could be in Clarington. It could be in Pickering. It could be in Oshawa. It could be in Whitby. We don't know that yet. But we do know that the requirements, or under the understanding that I have, is that it has to be up and running by April 1st. So I'm just concerned about that. I think the Heart Hub is a good step in the right direction. I think a lot more has to be done. But I'm hoping that more information could be made available so we understand where this Heart Hub is going and where these services can be utilized. And I'm hoping that, Madam Chair, you'll be able to find that out and we can make sure the public knows where this Heart Hub is now being allocated. So I appreciate the opportunity for staff to be able to answer those questions. So thank you to Lisa and to the Commissioner. And thank you, Madam Chair.
So Mayor Carter, I just want to echo just with your comments just about the transparency that needs to take place here. And it's, one that as the leaders for our community, that we need to ensure that, again, we got ridiculed for not being transparent, and we're trying to be transparent, but that opportunity is not being provided to us. So I want to thank you for sharing your frustration, and just that it is put out there that you and I and many of the other leaders in this room, the transparency is to another level of government, that they need to be transparent. And that's my 2 cents on that one. Any other business from any other members? Next meeting is March 6th. A motion to adjourn, please. Chair Henry, Councillor Dyes, any opposed? Thank you very much.